Hi guys, Dr. Blythe with Expert Spine Care. I'm going to talk to you about a little bit about osteopathic medicine. What does that mean? If you look me online, you'll see the initials D-O. All right. Now, most people are familiar with the initials M.D., which means for medical doctor. Well, D.O. means Doctor of Osteopathic Medicine. A little bit of background history on osteopathic medicine. There was a gentleman named A.T. Still. A.T. Still was a frontier doctor, and this was back in the late 1800s. At that time, when you were a medical doctor, you would use leeches, arsenic for different things, all kinds of crazy stuff to treat people. None of it was actually very conventional, and really a lot of people had some problems with these things. You know, imagine using arsenic today. You would be run out of the country. So A.T. Still was a doctor. He did his in those days, when you became a doctor, you actually went and followed another doctor. So kind of like a glorified on-the-job training. And did that, and as the story goes, and historically, A.T. Still had a headache, and he put his head down and laid it between two fence posts with a rope stretched across. And when he woke up from his nap, his headache was gone. And so it kind of intrigued him. So A.T. Still started doing some discovery. He actually went and studied models and cadavers and started using the body to kind of heal itself, and that's how osteopathic medicine was developed. The founder is A.T. Still. Since that period of time is developed over the years, in the last 150 years, if you will, now there are more similarities between DOs than there are differences between DOs and MDs. I am a orthopedic spine surgeon. I went to medical school. During my medical school, which is a little bit different than MDs, I learned osteopathic care. Osteopathic care is using manipulation to heal the body, realigning the spine. Some people will call that chiropractic. That's another subject. But osteopathic medicine believes that realigning the spine can help the body heal itself. Also, osteopathic medicine really is holistic. When I see a patient and I'm evaluating them, the principles of osteopathic medicine is to take the whole body, the whole patient, and understand what's going on. Just because you may have a shoulder problem doesn't mean that you don't have a spine problem. And so kind of digging in and going a little bit deeper is important in order to treat people properly and figure out what the root cause of the symptoms are. And it happens every day in my clinic. As an osteopathic physician, I went to 4 years of medical school. For my orthopedic residency, I went through 5 years of training. And then for my spine fellowship, I did an additional year of training just specifically in spine surgery. And that's how I've progressed from a DO going to medical school all the way through being a spine surgeon.